So I was just asking, should I ask one doctor all the three questions, or should I be
No, no, one by one, one by one. One
Uh,
question is suppose Dr.
so
Parag, so second question to the Dr. Mahesh, just like that.
okay, so we are going live. We are
Yeah,
live.
just a moment, ma'am. Only one from one cue to when you are on the screen. Like once video will be end, you can start your communication. Muntha, over to
okay.
you and start the show, please.
Good evening, everyone. So, first of all, I would like to invite all of you to this Endocrine Society of India Public Awareness Initiative. So, thyroid disorders is rampant in our society, and many a times people are having so many doubts, so many misconceptions that they, they are being taken advantage of by quacks and other practitioners. So, we as a team of endocrinologists would like to dispense a few doubts the general public is having on endocrine disorders. So, for that, I would like to invite four eminent endocrinologists from various parts of India to this Endocrine Society of India Facebook Live. And once again, I thank Endocrine Society of India office bearers, especially Dr. Lakshmi Nagendra, for giving us this opportunity. So, with that, I would like to invite Dr. Anudeep, who is an endocrinologist at KMC Manipal, Dr. Bhardi, endocrinologist at KIMS Vishakhapatnam, Dr. Mahesh, endocrinologist at Dr. Haki's Endocrine Center, and dear Dr. Parag Agarwal, who is an endocrinologist at Kokilaben Dhirubhai Ambani Hospital and MGM Hospitals, Mumbai. So, shall we start the program by asking questions? The first question I would like to ask to is Dr. Mahesh. Dr. Mahesh, do you think that is there any link between thyroid problems and weight gain
Def-
that doesn't respond to diet or exercise?
Sure, definitely there is a link between weight and thyroid for that matter. As we all know, thyroid is one of the most important organ in our body. And this is for the public awareness program. So they need to know what exactly is the thyroid gland and how it exactly correlates with the weight. Most of the patients do come to us with the complaints of weight gain and they think that this weight is mainly because of thyroid. So definitely it is one of the most common cause because as we know, thyroid, it mainly controls the simple, that is the basic metabolic rate. And definitely if the patients are having any sort of thyroid disorder, it has a link with weight. For example, if any of the patients are suffering from hypothyroidism, because of the hypothyroidism, they might have a fluid retention and the decreased metabolic rate, thereby leading to have a weight gain. And it's the opposite way in hyperthyroidism or thyrotoxicosis. There is an increased BMR, thereby leading to a weight loss, which is very common. So this in this way, weight is definitely associated with the thyroid-related disorders, and everyone needs to see whether either it is a weight gain or a weight loss. It can be just simply because of thyroid-related illness.
So, one another common question from general public is that many times thyroid disorders are overdiagnosed or underdiagnosed in pregnancy. So that it creates lots of confusion for this parents and in general public. So, how do you think, doctor, the pregnancy affects the thyroid gland, and what are the risks, if at all, to the mother and baby in case of thyroid disorders? Can you elaborate on the thyroid disorders which are seen in pregnancy?
Definitely, ma'am. There is a huge correlation with respect to pregnancy and the thyroid. As we know, pregnancy is one of the most as a gift given by the nature to all the human beings over on the world. So, pregnancy is one such thing where the requirement of all aspects of either it might be hormone or any nutrition, it doubles. So, the same way, there is an increased requirement of thyroid hormone during pregnancy. And one beautiful thing about the thyroid and pregnancy is there is a beautiful hormone called as HCG, which is usually done to detect the pregnancy confirmation. So it has a direct relation with the thyroid hormone. So whenever there is the initial first 2 to 3 months, what happens is this HCG, there is a rise in the HCG levels. Because of that, there is an alteration in the thyroid hormone. Even the simple test which we do as a screening for thyroid is a TSH, it gets suppressed during the first 2 to 3 months. And most of the time, what happens as an obstetrician, they overlook this and they start HY hormones and or the ATDs, and this leads to a lot of confusion once the patient comes to us. So what I tell, just correlate clinically and see how exactly they are having, whether it is a TSH, whether it is suppressed or not. So this is one way. And the second way is in pregnancy, most of the time what happens, if most of the time the because of the hypothyroidism or hyperthyroidism, there is an increased risk of infertility. And most of the females who are suffering with thyroid-related illness, they are having an irregular menses. Because of that, they might not be even conceiving, or it might lead to an infertility issue. So it's always better to get investigated if any patient they are suffering for infertility. So first get done thyroid-related testing. If they are done with that, then start on treatment. And what the message I want to give to the public is also that if if at all the patient is on medication, they need to compulsorily come and have a follow-up. What usually happens is during the pregnancy, what happens if the patient, most of the myth is there in public, they should not take any medicines during pregnancy. Once the pregnancy gets confirmed, most of the household females or the household elderly people, they tell don't take any medication. That is the biggest myth or the misconception what the general public have. What I tell is whatever the medications they are taking, let them continue, but meet at the earliest if they are having a already diagnosed with the thyroid related disorder. So what it affects to the baby, of course, hypothyroidism, if it is untreated, definitely it has a effect on the baby's brain development. Thereby, the baby can suffer with the what we call as the decreased IQ or the intelligent quotient. It get compromised. And in the other way around, if it is hyperthyroidism, and it is one of the toughest thing for endocrinologists to treat during the pregnancy. If the mother is having hyperthyroidism, definitely the child is at a risk of preterm deliveries, and even there is a risk of low birth weight, and the deadliest or the which is the toughest thing to us to manage is the neonatal thyrotoxicosis. So I tell all the pregnant women or the women who are planning for pregnancy, go through a routine screening test of a simple TSH or a thyroid stimulating hormone test as a screening, whether it is normal or not. Whether it is normal, then it's a no issue. If it has been here and there as suppressed, or there is something called as a clinical entity called as subclinical hypothyroidism, just get treated on time. And whenever they're planning to conceive, make sure it is under control. And once they get confirmed pregnancy, definitely they need to come at the earliest and show to the nearby physician or the endocrinologist who are better to treat the thyroid disease.
That's very well said, because just like in having an diagnosis proper, a follow up is also very important. So there is a lot of doubts about our entity called as Hashimoto's thyroiditis. Many people are actually fear mongering, making people stressed about, yes, you're having Hashimoto's thyroiditis and that will cause this, that, and everything. So can stress trigger autoimmune conditions? So can what are the other autoimmune thyroid conditions, and what is it relation to stress, or is there any relation at all?
Yeah, definitely stress has a correlation with other diseases also, and among them, thyroid is the one which has a even the correlation with respect to the stress. So what exactly happens during stress is there is something a hormone called as beautiful hormone in our body. We call it as a even the what you say the mood swing hormone. We call it as a cortisol. It gets stimulated because of that. There is a changes in the subtle changes in the thyroid hormone, and even this stress, irrespective of it can be a whatever, it can be a mental stress or it can be physical stress or it can be any disease related stress for that matter, they usually alter this HPA axis, thereby leading to trigger or even worsen whatever the autoimmune process which is already going on in the body. Thereby it triggers, or if it is already in process, it worsens that autoimmune process. And ma'am, you asked me what all the autoimmune diseases, as there are two important aspects. One you have said already, that is the Hashimoto's disease or the Hashimoto's thyroiditis. What exactly happens here is there is something antibodies named as anti-TPO antibodies. Most of the time, what happens to us, even being as an endocrinologist, most of the patient they do come. The day before yesterday, one of us patients she came saying, "Doctor, I have been diagnosed with hypothyroidism, and one of my physician they did TPO antibodies, and it is in more than 1,000." And she came like give some treatment to make this TPO antibodies levels to come down. So this is a panic, or there are some this thing where patients get panic seeing that there's such a high TPO levels. To tell the patients or the public that anti-TPO antibodies is one of the tests which suggests that there is an autoimmune disease which is ongoing, and not to worry about the levels of the anti-TPO antibodies. Definitely, it has a role in clinical this thing, but still don't get worried by seeing the anti-TPO antibodies levels. So what exactly happens is this anti-TPO antibodies they act on the thyroid gland and they completely destroy the thyroid tissue, thereby leading to an state called as hypothyroidism. So similarly, there is another autoimmune disease we all know is the Graves disease. In general, we tell it as a hyperthyroidism, where the thyroid gland starts acting more. There is a antibody, again a different antibody. We call it as a trap, that is TSH receptor antibodies. This antibody, what it does, it goes and acts on the TSH receptors which are available on the thyroid gland. Thereby, it makes more and more hormones, that is T3, T4, thereby leading to a state called as hyperthyroidism. So both the diseases, that is Hashimoto's thyroiditis and Graves disease, both are autoimmune disease, and both have a relation with thyroid autoimmune diseases.
So that was very well said. So, moving on to the next participant, Dr. Anudeep. So, what are the common? Is Dr. Anudeep online?
Yeah, yes. Am I audible?
Yeah, hi, Dr. Anudeep. So, the common early symptoms of hypothyroidism, and how can someone tell whether it is they are having thyroid-related illness or it is just general fatigue?
Yeah. In hypothyroidism, we commonly come across most of the times. These are all, there are multiple symptoms that usually overlap with many other non-specific symptoms. But most commonly, we come across the weight gain. They'll have cold intolerance, that they'll feel cold even in normal temperatures, and also fatigue, which normally it is different normal fatigue, which usually gets rid by rest. But in hypothyroidism, they will have persistent fatigue along with other symptoms like uh, they can have hoarseness of voice and also problems with their memory and dry skin. And also they complain of constipation, which has been persistent. And also, especially in women, they come with uh, irregular menstrual cycles, either menorrhagia or oligomenorrhea, most commonly menorrhagia. And most of the times, these are diagnosed when they come for evaluation of infertility, and they do thyroid hormone testing, and they find out. And other paid symptoms, like they can present with myalgias, arthralgias, and we do a routine blood testing, and then we find out they have hypothyroidism. And also, other common problem they say is hair fall. And during those periods when we test, also they have this hypothyroidism on biochemical evaluation. And even the fatigue, usually we can differentiate only if it is associated with other symptoms, then we can, most of the times it is because of the hypothyroidism, but generally other fatigue can be taken care by taking rest. So we need to look into most commonly constipation, cold intolerance, hoarseness of voice, myalgias, and in women, if there are menstrual cycle abnormalities and hair loss. With these symptoms, if they come to any clinician, we need to look into their thyroid function test and then diagnose.
Oh, yes, that was very concisely put. Any other coexisting symptoms, we always suspect hypothyroidism. So, Dr. Bharati, why do some people develop a goiter and is it always a serious sign of thyroid disease?
Thank you for the question. So, uh, goiter could be because of many reasons. First thing is iron deficiency, or even autoimmune thyroid diseases like Hashimoto's or Graves. Sometimes it could be multinodular goiter, or even sometimes pregnancy related hormonal changes. There would be a slight increase in the size of the thyroid gland, or the patient is having some amount of thyroiditis. Transiently, they may have slightly increase in the thyroid gland size, and it's not always a serious issue. It's predominantly it's benign. So when should you be worried is that if it is a single solitary nodule, or if the nodule is very hard, or else if the person or the patient is having some compressive symptoms like difficulty in swallowing or difficulty in breathing. These are the things. Or the patient is having something like severe amount of like what do you say, compressive symptoms. These are the predominant symptoms where someone should worry. Otherwise, predominantly it will be benign. So if there is any goiter, if they meet the nearest endocrinologist, probably they would work on it until if it is benign or malignant, or the chances of malignancy and all, it can be handled pretty well.
Thank you for that. And Dr. Parag, so one patient is diagnosed with hypothyroidism or hyperthyroidism, and they decide that they're not going to be treated. So, can you elaborate on what are the long term effects of untreated hypothyroidism or hyperthyroidism? Dr. Parag, please.
Yes, yes. So that's a really valid question. If we look at the logo of the Endocrine Society of India, it reads Yen Sarvamidam Tatam. That means that which pervades all, something that affects every system of your body. And needless to say, thyroid, both hypo or hyperthyroidism, can affect almost every system of the body. If we go with hypothyroidism first, that generally produces a chronic progressive disorder that affects multiple systems of the body. Most likely, patients gain some weight, 2 to 3 kg, 4 kg. This also brings along insulin resistance and also brings along fatty liver. It is not uncommon in our clinical practice to see patients with fatty liver and metabolic syndrome existing together. It also acts on the heart. It causes atherogenesis. It increases the cholesterol predisposition in the blood vessels. It affects the peripheral blood vessels to cause increase in the arterial stiffness, increasing the diastolic hypertension of these patients. Also, at the same time, it can precipitate heart failure for the patients and cardiomyopathies for the patients. So, multiple cardiovascular problems are associated with hypothyroidism. Also, it is not uncommon for people to come us with depressive features or some elements of dementia, and we diagnose them to be having hypothyroidism and not really any neuropsychiatric illness. Peripheral nerves can also be affected in the form of carpal tunnel syndrome and some form of myopathies. Patients can have aches and pains here and there, and often CPK-MB, the blood test that we do to diagnose these conditions, those come out to be high. And we get to know that this myopathy is because of the hypothyroidism condition that is existing in them. Another very common manifestation of the same is menstrual problems in females, patients who have anovulation, irregular menses, difficulty conceiving, or patients who have already conceived, they might have some issues with the baby. There might be preterm delivery, the patients might have preeclampsia or raised blood pressure during their pregnancy. The patients can also experience poor weight gain during the pregnancy. All of these features point towards undiagnosed or improperly managed hypothyroidism in these conditions. Along with that, we should also know about some very serious complication of hypothyroidism, which is known as mixed edema coma. Generally, old age patients, neglected patients in cold countries, when they do not take the medications properly, they might have a constellation of all of these features wherein they are poorly responsive, blood pressure is really low, they might have some form of anemia, low sodium, and drop in the blood pressure. All of these together are known as mixed edema coma. If we move into the another part of the spectrum, which is hyperthyroidism, we should be knowing that this is an acutely manifesting condition which predominantly affects the heart. It causes an increase in the blood pressure. It can cause an increase in the heart rate. Patients feel palpitations or ghabrahat. There can also be an irregularity of the pulse rate, pulse rhythm. There might be atrial fibrillation, and this can give rise to cardioembolic stroke. There might be a clot that is happening in the heart that is dislodging and going to the brain. Again, at the same time, this condition is characterized by increase in appetite but a weight loss. So these patients, along with weight loss, also experience muscle loss, and that is known as sarcopenia. Another very important target of hyperthyroidism is the bone. It causes an increase in the bone turnover, causing weakening of the bones or osteoporosis, what we know as, and this increases the risk of fractures for these patients. Some patients do develop goiter, as my colleague has already told us. Some patients also develop eye signs, which is known as thyroid eye disease. So, wherein the eyes might pop out, they might show redness, patients might experience double vision, and also the patients can have a frequency of diarrhea, and also they might feel a little feverish, and needless to say the menstrual problems can always be there, and some patients experience neuropsychiatric features in the form of decreased sleep, increase in agitation or restlessness. So as I said, hypo and hyperthyroidism both can affect all the systems of the body, and it is very important that we pick them up early, diagnose well, and treat them well to prevent these long-term complications for these patients.
Thank you, Dr. Agarwal. So, next question is to Dr. Anudeep. Doctor, do you think that diet or lifestyle changes alone can help manage the hyperthyroidism or hypothyroidism, or is medication always necessary to manage these conditions?
Yeah, diet and lifestyle do have impact on this thyroid disorders. But in some cases, when it is overt hypothyroidism or hypothyroidism, they need medications. They cannot be treated just with diet and lifestyle modification. As diet is important mainly in hypothyroidism, like if they are having low iodine intake, then it can be one of the reason why they're having hypothyroidism. Although current policy has most of the salts are iodized salts, so we need to check if they're taking sufficient iodine, and also whether they are having good nutrition in terms of uh, other things, like even zinc also has some role with respect to hypothyroidism. And selenium, in studies we have seen that selenium has some impact on thyroid antibodies. So, but we need much more data to substantiate that. And with respect to, there is a role of iron deficiency. If there is a iron deficiency, it is also a risk factor for hypothyroidism, and we need to treat that iron deficiency. And also, vitamin D also has some impact on hypothyroidism. So those replacing the vitamin D in those patients who have vitamin D deficiency also has better outcome in hypothyroidism. But subclinical hypothyroidism, when we call when on biochemical evaluation, when the TSH is more than upper limit and T4, T3 are normal, usually, and TSH less than 10, these patients usually do not need medication, but TSH of more than 10, we do have to treat them with medication. And sometimes patients might have higher TSH level because of obesity, which is due to a hormone called leptin, which can elevate the levels of TSH. So in such set of patients, just following diet and reducing their weight will make them normalize. And physical activity also had a positive impact on hypothyroidism, where they have seen a good physical activity had a good thyroid secretory capacity, and those who are physically inactive, they had a higher rates of hypothyroidism. And other diets like diet rich in iodine can be eaten, like seafood, which are having high iodine. And mainly the goitrogens should be avoided, like especially cruciferous vegetables, preferably uncooked cruciferous vegetables. Those should not be taken. So following this diet and also good sleep is other parameter that is required to maintain uh, or to control this hypothyroidism. So having a late night or less sleep also impacted the thyroid function in many of these patients. And also gut microbiota has a role in this thyroid disorders. So having a better gut microbiota helped in maintaining uh, better thyroid function in terms of taking probiotics, and also some environmental contaminants like, as you know, endocrine disruptors like BPA and phthalates can disrupt this microbiota, and also they can have thyroid dysfunction.
Thank you, Dr. Anudeep. So, Dr. Parag, are there any natural remedies or supplements that can safely support thyroid health by avoiding thyroid medication?
Yes, this is a question that I'm asked day in and day out by my patients in the clinic who are all wanting to go for something that is more natural, that can cure them of hypothyroidism or hyperthyroidism, and in the hope that they may be taken off the medications. But a simple one line answer to these questions would be the natural supplements at the moment do not fare as good as the evidence based therapy that these patients are warranted to take for hypothyroidism or hyperthyroidism. The reasons have already been discussed by Dr. Anudeep. We need to know that there are some natural micronutrients. One of the most important is iodine. Iodine is a part of T3, T4 hormones, both of them, and a deficiency can definitely cause hypothyroidism like features in the patients. But now, with the universal iodization of the salt, there are hardly people who have iodine deficiency, except for people who live in hilly areas and who might not be consuming salt in adequate proportions. Having said that, if the patients take in a lot of iodine in the form of supplements or health boosters or thyroid boosters, as my patients have shown me they are available on the market, they can cause something known as Wolff-Chaikoff effect, or they can cause something known as hyperthyroidism or hypothyroidism because of Jod-Basedow phenomena. So both of them can happen in the patients depending upon the pre-existing autoimmunity status and pre-existing iodine status in them. So for the general patients that we know, iodine is definitely there in the salt, and hence no other supplement from outside is needed. Number two, Dr. Nudeep also spoke about selenium. Now we know that selenium is also very much important because it is one of the enzymes that is required for thyroid hormone production. So, if the patients have a deficiency, it is important that it is corrected. But at the same time, it is also important to note that it only reduces the anti-TPO levels, and symptoms may not be benefited simply by selenium replacement. Some people do use it for mild thyroid associated ophthalmopathy, and that is the only area where roughly 100 microgram per day is generally recommended. Vitamin D, that may be a bystander in any autoimmune condition, and it is only for the general health benefit of the patients that it should be replaced and it should be corrected. Otherwise, it may not help the patients with thyroid disorders. Likewise, I would like to say for zinc and iron, because iron is an important element of anti-TPO antibody, anti-TPO enzyme that is present in the thyroid. At the same time, some people from traditional Indian knowledge want to use ashwagandha or adaptogens, which may be used for supplementation in cases of hypothyroidism. We do know that those might reduce the requirements of thyroxine. They might produce some symptomatic benefits, that subclinical hypothyroidism might be benefited. But please note that these are limited to small trials only, and it is not a standardized protocol that we know, and it should not be recommended for all the patients universally. It is only a small, maybe anecdote that we are facing. And of course, about the patients who do not want to take soya chunks, that is a very common myth that these patients have. So I recommend that just pace it out by 4 hours along with the thyroxine medication so that the thyroxine is absorbed well. And also you get the best of proteins from soya chunks so that you do not land up with sarcopenia. I believe those are the very important points that every patient with thyroid disorders should know, that no thyroid supplements, no thyroid boosters, or no natural remedies can cure them of hypothyroid or hyperthyroid, and nothing can replace the treatment that is based upon evidence-based management and that has been brought forward by multiple trials in the clinical practice. Thank you.
Thank you, Dr. Agarwal. So, Dr. Bhardi, you have elaborated previously on goiters. So, what causes thyroid nodules and when should be somebody worrying about thyroid nodules? Can you please elaborate on that?
So thyroid nodules can be seen in almost 40 to 50%, but the thing is they are not palpable. But the palpable percentage is only hardly 2 to 6%. So the main causes being, again, as we spoke, it could be thyroid cysts, it could be Hashimoto's thyroiditis, it could be multinodular goiter, or it could be even because of iodine deficiency or because of Graves who are on not on regular treatment may land up in nodules. But the malignancy, if a person is having thyroid nodule, the chances of having malignancy is only 5 to 15%. So when should one worry is something is they're having a rapid growth of that nodule, or if that nodule size is greater than 4 centimeters and it is hard and not able to move with deglutition like other thyroid goiters or anything. Otherwise, they have symptoms suggestive of like compressive symptoms like difficulty in breathing, difficulty in swallowing, or else they may feel difficulty in breathing on supine, sleeping in supine position. In such conditions, probably they should rush to the endocrinologist. And once they come, the thing is, first we do an ultrasound, and based on the scoring, we'll decide if we have to get a fine needle aspiration cytology or not. Based on the FNAC, if it is suspicious of malignancy is very high, then we go for total thyroidectomy or hemithyroidectomy, depending on the size of the nodule. So only when the symptoms are there or there is increase in the size of the nodule rapidly, only then they should worry about the nodule. Otherwise, once in a year ultrasound would be sufficient.
Thank you, Dr. Bhardi. So, our next question is to Dr. Anudeep. Is there any particular diet to be avoided in patients with thyroid illness? I believe that's partly answered by Dr. Agarwal, but still, could you please elaborate on that?
Yes, as told, goitrogens. So these are like common foods which we see in our day to day, like cabbage, cauliflower, all these vegetables that are belonging to cruciferous family or brassica family, and even broccoli. These are not harming if they are cooked, because the cooking will denature their goitrogenic property. So cooked cruciferous vegetables can be taken, but they have to be careful when they are taking, and it is advised to avoid uncooked when you're eating salads or these kind of things. And the other one is soy products. So soy is the other thing which is goitrogenic, and it can lead to hypothyroidism, and also we need to avoid that. And as we have a now universal policy of iodinization the salt, so I believe most of us are taking sufficient iodine, unless during times of excess demand like pregnancy, we need to take higher dose of higher dosages of iodine. So that's why in such cases we need to take higher iodine, or else normal iodine intake would suffice. And other micronutrients deficiency through diet we can take in terms of iron, and which through meat products we can take, or dairy products that can be taken. But main things we need to remember is to avoid the goitrogenic foods, that too uncooked ones, soy products. And the other exception is with respect to millet. Sometimes millet also is a kind of having goitrogenic property, so we need to be careful when you eat excess millets. So we need to avoid millets also, but only in excess. But rest all diet we can have. And also red meat is also sometimes advised to be taken very less quantity in these thyroid disorders. Thank you.
Thank you. So, Dr. Parag, and there is always a doubt regarding the family history in thyroid disease. So, how often or when do you suggest a person to check their thyroid function if they are having family history of thyroid illness?
Yeah. So now we have moved on from reactive medicine, wherein the patient is coming to us and seeking treatment, to responsive medicine or proactive medicine, wherein we seek the patient's conditions even before they have become symptomatic, so that we treat them at the base itself, preventing the long-term complications that I have already alluded to. It is not uncommon for patients coming to us and asking us, if I have thyroid disorder, what is the risk of my near and dear ones of having the same condition? So, the basis of this question lies in the concept of autoimmunity, wherein the body itself is killing its own cells and causing this condition to happen in the other relatives of the patient. If some patient has a risk of autoimmune conditions based on first degree relatives, or because they themselves have some other autoimmune condition like type 1 diabetes, like vitiligo or white patch on the body, or if they have hyperthyroidism or hypothyroidism like features, these patients have a very high risk of having the autoimmune thyroid disorders. It is very important that we screen such patients with at least anti-TPO antibodies and baseline TSH. If these come out to be negative, these patients can be safely followed up every 3 to 5 years unless some other inciting feature or clinical feature appears. If this at the baseline appears to be positive, these patients should be screened every yearly and picked up as soon as possible and treated. Second important condition that I would like to highlight is patients with pregnancy or those planning pregnancy, because that is a very important time wherein the development of the baby is going to happen, and it is worthwhile that the mothers are euthyroid before conceiving and at least in the initial part of the pregnancy. Third important area where I would like to highlight the role of this screening is in the elderly patients, because therein we do not want a very tight control of the thyroid. I have very often seen patients coming with TSH of 5 or 6 and they are maybe around 60 years, 70 years of age. So it is important to note that these are not the patients who should be treated unless otherwise indicated. Because if we land them up with hyperthyroidism because of our treatment, the heart and the bones would stand to lose. And hence, it is important that we individualize the targets for different patients depending upon the comorbidity, depending upon the clinical features, and upon the risk factors. And last but not the least, we as Asian Indians, we have a very high risk of autoimmune conditions, a very high risk of cardiovascular conditions, of dyslipidemia or cholesterol issues also. And it is very important that we pick up these disorders early on, so that if we or any in our family member has these conditions, everyone should be screened, treated accordingly, and prevented for the long term cardiovascular ill health.
Thank you, Dr. Agarwal. So, this is the last question of the day, that is to Dr. Bharati. What are the newer treatment modalities which is available for goiter? And also, can you elaborate on the minimally invasive surgical options?
So first thing is non-invasive are like not non-invasive. Probably a daycare procedure is one thing is radio frequency ablation, and the other is ethanol ablation. In radio frequency ablation, usually it is a daycare procedure. It may take up to 45 to 90 minutes, and usually they send the heat so that the entire cyst or the nodule usually shrinks in size. And once it is done, it usually that whatever the radio frequency ablation, the procedure, I mean, the process usually continues for almost 6 to 12 months. Throughout that 12 months, there would be chances of shrinkage, and the shrinkage is around 50 to 97%, and the side effects are very minimal. And coming to the ethanol ablation, it's predominantly done for cystic nodules. Say if the thyroid nodule is completely cystic, what they do is they usually aspirate the entire cyst and they seal it with they inject the ethanol into it. and seal it with it, so that there may be some amount of necrosis and it wouldn't it wouldn't recur again. These two are predominantly being done. And other things like minimally invasive or other routes are like intraoral thyroidectomy are being done, or even intra-axillary approach are also being done. So, and even minimally invasive, probably with 1 centimeter incision, also they're right now performing in various parts of the country.
So thank you, Dr. Bharti, for that. And that was the last question of the day. And if you could give one take-home message to our listeners, that would be much helpful. So, Dr. Bharti, can you give your take-home message, please?
There is a lot of myths against thyroid, and especially because it's the easiest one to be targeted. Thyroid reversal, or the diet and exercise to reverse thyroid, the diet and exercise to reverse thyroid cancer. No such entity exists actually. Please don't believe to any of the myths. If you have any doubts, please meet the nearest endocrinologist for clarifying all your doubts.
Dr. Mahesh, could you please give the take-home message?
Sure, ma'am. I just tell to all the general public, feeling normal is always doesn't mean your hormones are at normal. I tell them at least once in a year, just get screened for hormone related issues like a diabetes or a thyroid for that matter. So because as we know now, and even the what you say, the childhood obesity is on the rise, and other aspects of thyroid is very common among males also nowadays, because as often we are seeing only related to females. Now even the males have more hypothyroidism. So I tell them feeling normal doesn't mean your hormones are normal. At least screen once in a year. Once they are normal, at least we can go through clinically. Then we can think about rescreening at least after 2 years or biannually thereafter.
Thank you, Dr. Mahesh. Dr. Parag Agarwal.
Yeah, so one statement that I always speak to all my patients is, if you diagnose and manage your hormonal problems today, you stand to get benefited 10 years down the line. I'm not treating you for your immediate concern. I'm treating you so that 10 years down the line, you don't come to me with heart failure, with kidney problem, with liver problem, with any other problem that can have its root in endocrine. And I very safely say almost all the diseases have some association with the hormones. So treating today will give you a better life tomorrow. So please don't fall into that traps, as my colleagues have told, of treating, curing, or reversing some of these conditions, which are long-term chronic conditions. Proper steps today will give you great dividends tomorrow.
Thank you, Dr. Agarwal. Dr. Anudeep, take-home message, please.
Like to tell all the public, as my other colleagues said, do not take these things carelessly. You treat, these are very easily treatable diseases. Do not get into the misinformation, or don't be misguided by non-experts. You have when you have problem, please consult doctor, take right opinion from the experts, and get treated, as this will go a long way in making your life comfortable. And as diet and lifestyle do have impact, but it is not that everything will be treated by diet and lifestyle alone. You need to take your medications regularly and come to a follow-up with the doctor and follow a healthy diet and lifestyle modification, so that you will go a long way as any other normal person who doesn't have any disease.
So,
Thank
I think, thank you, Dr. Anudeep. So, thank you once again, Endocrine Society of India, and thank you, viewers, for your patient listening. And I would also like to thank USP for the collaboration. So, thank you all, and have a great day, and have a great weekend.
Thank you.
Thank you. Thank you so much.
you.
Thank
Thank you. Thank you, Dr. Anderson.
Technical team.
Yeah, kindly end the live, please. Yeah, it's ended.